Hi there, Bob Burdican from New Wave Therapy. And with all the talk that's been going around about coronavirus, it seems that some of the things I've noticed are getting overlooked. And one is how to work with our horses and how to take care of them. Well, I downloaded off the internet today from the Equine Disease Communication Center, which is part of the American Association of Drugless Practitioners for Equine, their fact sheet. And of course, I'm going to go through it with you. The disease name, it's an equine coronavirus. They call it ECOV. It's called a viral type of disease. It's a RNA virus. The transmission is it's spread when feces from an infected horse is ingested by another horse. It's classed as fecal-oral transmission. The virus can also be transmitted when horses make oral contact with surfaces or objects that are contaminated with infected feces, like stalls, muck forks, manure spreaders, thermometers. Even your own hands and clothing are common forms or materials that will carry the infection that can be passed on to them. But it's also noted that coronavirus is most notably diagnosed in the winter months. The frequency, they say, is low. The incubation period is anywhere from 2 to 4 days. And a carrier status is currently unknown, but subclinical horses, that means horses with no clinical signs, have been found to share or shed the virus themselves. The shedding period for most horses is unknown and is still under investigation. And by the way, this has a copyright of 2017, and it's a revised copy for 2017. So, like I said, it's still under investigation, but based on existing reports, the virus has been found to present in samples anywhere from 5 to 21 days post-infection. So horses with no clinical signs of disease can shed the virus, and it's unknown how soon infected horses become infectious. But the feces of infected horses does pose a risk to other horses. Now the severity, they say, is mild, but mortality does occur in complicated cases, and they say that miniature horses seem to be more severely affected than any other type of breed or type. Clinical signs and symptoms, they'll have a fever up to 105 degrees Fahrenheit, or if you use centigrade, it's 40.5 degrees. There's a loss of appetite, there's depression, there can be colic, they'll be laying down frequently, having diarrhea, it may or may not be present, and they have a low white blood cell count. Now the complications that can occur in rare cases is protein loss, dehydration, neurological signs such as being lethargic, depression, loss of body control, and which is secondary to an excess of ammonia in the system. It can actually even affect their progress or inability to stand, and well, eventually, if it gets that complicated, it could lead to death. Now, the diagnosis is made by a veterinarian submitting samples for PCR, which is polymerase chain reaction tests in a fecal sample. The treatment is, the primary treatment is supportive care based on clinical signs. Severe cases may require hospitalization for IV fluid treatment or treatment for secondary infections. The prognosis is good. Exposure to the virus can result in up to 85% infection rate, but most animals do not show clinical signs. Mortality is low, but it can occur again in complicated cases. Now, as far as prevention, they say that there is no vaccine to protect horses from equine coronavirus infection. The best method of prevention is to maintain high standards of sanitation in all equine facilities and carefully disposing of manure where it cannot contaminate pastures, paddocks, or even the drinking water. Now, when cleaning surfaces that may be contaminated with feces, clean the surfaces first to remove all traces of organic matter and then disinfect. Now, biosecurity is any horse with a fever and no evidence of respiratory illness may have equine coronavirus, and feces may be infected. These animals should be isolated by handling them last when feeding, grooming, or cleaning stalls to prevent possible infection to the other animals. Horses that are moved to a new facility from a facility where horses have been positive for the virus should be isolated for 3 weeks. Feces can be checked prior to removing horses from isolation. That's the entire fact sheet that they put out. Now, I'm going to go ahead and also put the link to this in this post as well. So, just wanted to share the information, let you know that we're trying to stay on top of everything, and hopefully that you've got something good out of it. And thanks for listening. See you soon.